And finally, I think this might be the last one. Let's touch on reflexes and the autonomic nervous system. We do have one more system to talk about, the endocrine system, but we may do that just in class. So this might be it. So for this one, I just wanted to summarize. Your book goes into a lot of detail here. Summarize what we're talking about when we're discussing reflexes, why they're important to assess, and also talk about the autonomic nervous system just in passing, because you'll see that a lot of medications that you would use are going to target aspects of the autonomic nervous system. First, what's a reflex and why do we have it? A reflex is going to be a response that does not require higher level thinking or the central nervous system. Well, let's clarify. It does not involve the brain. The reflex arc you see here involves the receptor, a sensory or afferent neuron, an integration center, a motor neuron, and an effector. So a reflex is going to be a reaction that doesn't require thought to process that information. What's the value of a reflex? Well, if you had to touch a hot stove and wait for the information to travel from your hand all the way up to your arm, to your brain, for you to process that's hot, send a signal back to your brain, back down your spinal cord, back to your nerves, back to your hand before you pull it off, you're going to do a lot more damage. If someone throws something at you and you blink, you have a reflexive response. So reflexes are protective mechanisms that are going to be a quick response that don't necessarily involve higher level thinking. So what you see here, the stimulus, a pin sticking into the skin, is going to activate a receptor, sends a signal to the sensory neuron. It will then bridge from a sensory neuron to a motor neuron through an interneuron. So the central nervous system is still involved in the spinal cord, but rather than the impulse having to travel up to the brain, it simply bridges to an interneuron through a motor neuron to an effector for a response. When we think about our reflexes, we can think about them in a couple of different ways. In one way we'll talk about them here is looking at them from a functional classification. You have some somatic reflexes, and these are the ones that we associate with blinking or when the doctor pounds on your knee and you have a reflexive reaction. These are skeletal muscles, so they're somatic. And then autonomic or visceral reflexes are those where smooth muscles involve cardiac muscles or glands. And think of the example, you go outside on a sunny day and you have your eyes will instantly, or gradually I guess, the pupil will close off some more. As you don't have to think about that. That's an autonomic or a visceral reflex. I just give you one example here, and I'm not interested in knowing the details of this, but just to show you once again how we go from and this is the patellar reflex obviously, with stimulation when the patellar ligament is tapped, that causes some stretching of the quadriceps, and it excites some muscle spindles. We saw muscle spindles a few videos back, but they pick up on that slight action, that slight stretching of the quadriceps, which sends a signal via an afferent neuron. You have an interneuron here bridging, and don't worry about the 3A and the 3B, but then you're going to have a firing along a motor neuron, which will cause the hamstrings to respond. You see here in red, the motor neurons are sending the activating signals. The green, actually, you see here is an inhibitory signal, so that we relax the hamstrings to allow the contraction, the movement of the quadriceps, and therefore your leg goes forward. So you see both an excitatory and inhibitory response to make the leg go. Again, why have a reflex at all, and why is this one even valuable? Whenever we have to move or stretch in any kind of plane, we may have to shift our weight and shift muscles responses. Think about even just walking. There has to be a coordinated response that you're not necessarily thinking about of muscle contractions. So the patellar knee-jerk reflex is an example of a stretch reflex. There are several kinds. I'm not interested in you knowing those, but you should know the reflex arc, the components of a reflex arc, going from receptor, sensory, interneuron, motor neuron, then effector, a muscle or a gland. Okay, so why do we care about these? Whenever we're testing someone's spinal or somatic reflexes, like we just saw with the hitting on the knee, we're really testing them to clinically assess the nervous system. We have a difficult time determining if the nervous system is working without some pretty fancy tests, but as simple as shining the light in your eye and seeing if your pupil constricts when you are exposed to light shows some example of reflexive response. Clearly, if somebody has a head injury, and we saw this a lot when I was an EMT, one of the things we're doing is we're shining the light in the eye, and we should see a common response among the pupils. If one eye dilates and one eye constricts, that tells us a head injury has affected the nervous system, and therefore we could have some big problems. So an exaggerated, distorted, or absent reflex tells us something about the health or the wellness of the nervous system. And let's close with just a brief look at the autonomic nervous system, and I just want to remind you where it is in the hierarchy of the nervous system. When we have the peripheral nervous system, we do have the sensory division, afferent, and the motor division. Somatic is what we control. That's skeletal. But autonomic has the two branches, the sympathetic division and the parasympathetic division. So again, notice these are motor, that is, we're going to have a response from these, but it's going to be outside of your voluntary control. The two branches work more or less in opposition. And I say more or less because there are some slight differences that we won't dwell on. But you see in this example, the sympathetic is going to cause the dilation of the pupil, where the parasympathetic signal is going to cause it to constrict. The sympathetic is going to it's going to inhibit the flow of saliva. The parasympathetic is going to stimulate it. So you see how they work somewhat in opposition, and I think of this, and you got to be careful here, somewhat like a gas pedal and a brake. Now, before you assume that the sympathetic always is the gas pedal and the parasympathetic is always the brake, just look at this example. The sympathetic inhibits the flow of saliva, but it accelerates heartbeat. Parasympathetic stimulates the flow of saliva, and it slows heartbeat. So they work in opposition, and the sympathetic usually stimulates, but the parasympathetic may in some circumstances. So don't always assume sympathetic increases and parasympathetic decreases. Just to give you a brief way of thinking about these, the parasympathetic can be thought of as the rest and digest system. This is really how we gain or conserve energy. So this is going to be kind of the gear down response, if you will. But again, we're going to see stimulation of things that help us gain energy. So if you think SLUD, salivation, lacrimation, the production of tears, urination, digestion, defecation, diuresis, which means to produce urine, that's the D system. So again, think about this. To support or conserve body energy, salivation is going to be required to process food. Urination, once you process food, you must get rid of the urine. Digestion, obviously, is to process the food. So what you see here is, this is again kind of the chill system. Decreased blood pressure, heart rate, diameter of airways is going to be relatively small. We're kind of in the chill mode, and we're just going to conserve, and we're going to gain energy from our food. 90% of the parasympathetic, as you see here, is controlled by one cranial nerve 10, the vagus one. And you see here, cranial nerve 10 is responsible for affecting the parasympathetic effect of all of these organs. So, parasympathetic, rest and digest. Sympathetic is what we associate with fight or flight. And I know you've heard this term before. If we are faced with some kind of emergency or some kind of really stressful situation, our body kind of takes over and puts us into a mode of we either must fight this potential threat or we must flee from it. So we're going to have to put our body into a high energy mode, and things like pupils dilating, we want to be able to see really well. Heart rate is going to increase, blood pressure is going to increase, but certain things are not going to increase. Non-essential processes are inhibited. What might be non-essential? For example, there's no reason to process your food right now. There's no reason to make urine. There's no reason to make more saliva. So we tend to see we're going to cut back on those functions because they're not essential to our survival. We can digest later if we survive the big bear chasing us. So sympathetic is fight or flight. I think of the E system for this: exercise, emergency, excitement, embarrassment, activate our sympathetic part of our autonomic nervous system. What do we mean by embarrassment? Think about, you're going to have to give a speech in a class and you just don't like public speaking. What happens? You feel your heart rate increase, your mouth goes dry, you may get a little sweaty. You are sympathetically having this response. You are, in a fearful situation, so you see that. So again, they work somewhat in opposition, but again, please, one more time, don't assume sympathetic always means to increase, because as you see here, we're constricting blood vessels to our kidneys and our GI tract because they're not essential to the fight or flight response. Notice this difference as well. Parasympathetic, when we associate where the anatomical origin of the fibers that control it come from, these are going to be classified as craniosacral. If you look here and you look there, that's where the fibers come that actually affect those functions. And as I said before, most of the craniosacral functions are going to be associated with the vagus nerve 10. The sympathetic is going to be mainly thoracolumbar. So you see the nerve roots coming from the spinal cord here are going to be from the thoracic region and from the lumbar region. So that's just one more difference, how the origin of these fibers are coming from different places. And if you look very carefully at this, you'll see that they're not exactly the same. You see some slight differences here. I don't want you to stress about them, but they work more or less in opposition. And again, this is autonomic. You don't decide to control these. They will be controlled autonomically in response to either housekeeping or in response to stress. That does it for our videos. Thanks very much.